Thank you, Jeanette. In this week's Purina Pet segment, we know diabetes can be a serious condition in humans, but did you know hundreds of our pets suffer from it too? Vet Megan Alderson is here with a friend, Kitty.
This is Kitty Britton.
Kitty Britton, welcome. I know Kitty's mum is watching as well.
Yep.
Julie,
hi, Julie.
How are you going? Thanks for lending us Kitty today. Kitty obviously has diabetes.
Yeah, Kitty's had diabetes for a number of years. She's got type 1 diabetes, which is the most common form in dogs. And we picked it up.
So type 1 is the hereditary one, it's not the one you get from overeating.
Well, as I said, she probably didn't help that she's a good eater, and I think that does tend to be the case. But Kitty's had it, and so did her brother, who is behind us, Archie, who's unfortunately no longer here. But
because of the diabetes?
Yeah, he got diabetic ketoacidosis, which is a pretty serious condition when the diabetes becomes out of control. And at that point, yeah, he was not going very well, so we actually made a hard decision. But we miss him terribly.
If it's hereditary, is there anything I can do if I'm going to get a puppy or adopt a dog to check, or...?
At this stage, no. Like, we are starting to come out with hereditary tests for common diseases in dogs. So what is happening now is the breeders are actually starting to do genetic testing, but as far as I know, diabetes isn't on the list.
The thing about dogs and cats as well is that they don't talk to you, they don't really say much, and they soldier on.
That's
so
right.
How would I know if I thought my pet had diabetes?
And it is Pet Diabetes Month, and that's what we're here to say. That it's actually, there's clues, and people miss them because the pet still looks healthy and happy.
Right.
So the clues are usually that they're starting to drink more, therefore urinate more, so you're needing to go to the toilet in the middle of the night. They are really excessively hungry, and they actually lose a lot of weight with it. So those are the 3 or 4 clues to basically get them down to the vet. Now, actually what Kitty got was a urinary tract infection, and that's, you know, a telltale sign also of diabetes, because what happens is a high blood glucose, you know, that doesn't get controlled, is a great breeding ground for bacteria, and oftentimes that's how they'll present.
What's the prognosis like?
The prognosis is very good. They are treated with insulin similar to humans, so we do actually need to get them on insulin injections twice a day, so we have a committed owner, okay, that's necessary. But what the prognosis is, they'll live a normal lifespan, so those dogs will go on to live normal lives if they get the insulin treatment on a daily basis, and if we can get them under control.
Because type 1 is very serious in humans, isn't it?
Very serious, and I think it does go on to, you know, the fact that humans live a long time.
Right.
It's a very difficult disease to run a beautiful curve every day, so it's hard for us to control. And I've learned that, you know, having a human diabetic in the family, you know, with these guys, my main aim is to, you know, keep them in the home, keep them at a constant weight, make sure their water intake is just so, and I don't worry about doing blood glucose and making things perfect all the time, because that's unrealistic.
How old is Kitty?
Kitty is 10.
She's doing well?
Yeah, she's doing well.
There's not much grey around the muzzle there.
She still enjoys her walks every day. She has a Keeley, her little dog walker, comes around, helps Mrs. Britton with the injections, and yeah, Kitty's going to live for a long time, so I'm having to think about, oh, okay, might have to get her teeth cleaned and things this year. Are
there any breeds that are more prone to this than others?
Certainly, if we look at cats, Burmese, you know,
really?
I had a couple of Burmese in on Monday, both diabetics.
Wow.
So I think Burmese and elderly cats, definitely. I think Australian Terriers is what I see most of, but Bichons and also Westies, yeah. So I think small breed dogs, and I think Labradors, you know, given the propensity to weight, you know, I think Labradors, older Labradors, that again we see them, you know, at a later age, but the middle-aged ones are usually the smaller breed dogs, and so anyone can get it, but it does tend to be certain breed lines that we see more of it in.
Look, I hate to bring it down to finances, but when you find out your pet is, you know, how expensive is it to give those 2 shots a day?
Well, basically, the expense isn't the shots. Definitely the insulin isn't the major expense. It's the testing and actually getting the curves right, so it's the veterinary care. So we try and make it manageable for owners. We want everyone to be able to treat this disease. oftentimes we can use human insulin, which makes it a bit cheaper. We just have to get them on the right one. And if we can get the owners home testing with blood glucose machines, glucometers, just the same as what we use in humans, so we do ear pricks and we get them doing a curve over the day and sending it to us, it does cheapen the cost of the diabetes. But certainly you need a committed owner. I think that's the big thing, is that you've got to be there twice a day to give your dog insulin, give your cat insulin. Diet's really important. Yeah, so getting them on the right diet's very important.
Okay,
and it's not a cheap disease.
So those symptoms again: drinking a lot, weeing a lot. What was the other one? Eating a lot. I've got all three of those so far, but
well done.
I'm not dropping weight.
And dropping weight.
All right. If those sound familiar, the most important thing is to get along to your
simple
vet
test
ASAP and have the test done.
Just a pee test.
And save the date. We're having a Purina Best in show on Wednesday the 12th of December where your pets could win prizes. Have you got a fabulous feline or a delightful dog? Why not bring them in here on December the 12th, and our panel of judges will decide who gets the top prize. But coming up, you decide who's the cheekiest pet in the land and what happens when you combine taonga artists with youth in a museum. We hear from one of the young performers in urban life next.